They put them in there because there was, first of all, a lot of anti-Republican sentiment 2 years ago. The other thing is Barack Obama campaigned against a mandate. He buried Hillary Clinton because Hillary Clinton was for a mandate.
You're actually
so when you're saying
right.
that the American people voted for Barack Obama, they voted for a person that campaigned on transparency, on bipartisanship, open deals on C-SPAN, how we're going to talk about this, no mandates. And in the end, what he's talking about is everything opposed to what he campaigned about.
And that's exactly what he provided, and that's what he got burned for.
This president, I think, is going to go down.
He does have a point there on that, though.
This president's going to go down as one of the most hypocritical, partisan politicians or presidents that we've ever seen.
That's a strong word, but you know, you do have a point there, and I do agree with you that this was. I remember the debates with Hillary, and I remember him saying, "Oh, Hillary, how dare you, put forth a mandate?" I remember that. I'm glad you brought that up. But so. Let's think about this.
We're dealing with it was a relatively minor tit for tat within the Democratic Party about how much federally controlled mandated change over healthcare and system was going to be provided. Barack Obama won that debate for a reason, because Hillary Clinton came in rather unprepared for that kind of response. The discussion between Republicans and Democrats has nothing to do with that. It has to do with the fact that healthcare reform as an issue itself is considered to be the biggest threat to the American system of democracy, as the Republicans in the House and in the Senate have said. They're presenting this entire issue, which they are now rather wishy-washy in favor of, at least the details of it happen to be difficult to oppose. They're against it based on a caricature, based on an ideological caricature that they started manufacturing through Fox News and Rush Limbaugh and Glenn Beck 6 months ago, and it's built up to this particular point now. And that's not the debate that happened between Hillary Clinton and Barack Obama. I think we can at least agree on that.
Barack Obama was against mandates, and now he's for it.
Well, let's hit this cost thing, because I do want to move into another part of the conversation. I want to start talking eventually about sort of other nations and some of the things we can learn from them and what we can bring in. But this cost issue, Raphael, I got to say this, man. I really have to say this. Republicans are crying about the cost of this, and yet the largest expenditures of the federal government, number one, 39% of our budget is spent on senior programs. Number two is defense. Number three is interest in national debt. And we're crying about giving, people, not even giving them full health care, providing subsidies, expanding Medicaid, et cetera, and even increasing regulation. We're crying about the cost when it's kind of like a person who is on a diet and they go to McDonald's and they order a Big Mac with a large fry and they get a Diet Coke at the end. If we really want to deal with the issue of cutting costs, why are we talking about these kinds of programs? Why not go after the real programs that are real expenditures?
Medicare and Social Security.
Yeah,
right?
absolutely.
Yeah. And what we just did right now is expand basically health care. I mean, we're becoming more of a quasi-socialist state, a nanny state that wants to give everything to everybody. In terms of the costs, do you realize
corporate capitalism is not very generous?
Do you realize,
that's the very problem that we're faced with.
Do you realize that in 2 years, our national debt will be larger than the size of our economy?
Yes.
And we are still piling on this debt. Republicans.
I agree, and I think on a certain level it's irresponsible. But what I'm saying is, let's shoot at the right places. Let's get on TV, which you'll never hear a politician do, and say, which they did partially in this healthcare debate in terms of reducing Medicare spending. But let's get on and say, you know what? We need to reevaluate. We're going to start cutting in areas like Social Security and Medicare. We're going to start cutting in defense spending. We're going to start cutting in these areas because these are the major expenditures we have. But nobody's going to do that because they're not going to get elected.
But the entire budget, the entire budget issue is actually again been handled, I think, rather reasonably. The CBO has already come out and said that this is not going to increase the deficit.
No, that's not.
This particular program, while it's going to certainly increase the amount of coverage for Medicare, it is still at the same time rather long term. It's rather unpredictable as to what the costs are going to be.
I want to address this concept that it was a revenue neutral bill. Yeah. The only reason that CBO came out with the surplus is for two reasons. First of all, they didn't include the doctor's fix, which was going to happen. Why wouldn't you include that in this health care bill when it's about payments for doctors? That would have flipped it from a surplus to a deficit. The reason they took it out because they wanted to be able to say it was a surplus. And the second thing is that for some reason they put in student loans into this program
which we haven't talked about
which
yet.
Adds revenue to the bill, which has nothing to do with health care. But again, it gives the administration an ability to say the CBO says it's deficit or surplus.
Here's the game that's being played. The CBO comes out and says that we're going to be able to, that we are going to actually go from budget surpluses in the 2000s and the late 1990s
to
major deficits
yes.
as a result of tax cuts.
Yes.
And those figures end up becoming almost to the
just as a
dime
result of tax
predictably
cuts,
true.
Not just
And the
tax
Republicans
cuts, man.
as a result of that ignore the CBO's figures, and what ends up happening, the CBO ends up being exactly right about it.
I got to tell you, in all honesty, and the American people should look at it this way. This is not a Democrat-Republican issue, okay? Politicians are politicians. And politicians twist arms to get legislation passed on both sides of the aisle. Politicians promise things that they don't deliver on both sides of the aisle. So let's keep that real. But what I want to really talk about is, why is it that in our system of government, you can make so much money in the healthcare industry, whether it be a doctor or the pharmaceutical companies, et cetera?
Because it's not a system of government, that's why.
Well, in our nation, okay? Right. And so, but this may be, I think, where we could have probably the best conversation. What can we do to limit that? Now, if you look at some of these other nations in the world that, some of them provide universal coverage, some of them don't, but many nations have got involved in regulating the amount of money that doctors can charge for services, that sort of thing. They've done a lot they've got not-for-profit insurance companies to try to bring the cost down. So let's see, maybe if we can kind of figure out a way that we can find some common ground on this, and maybe we'll give hope to the rest of the world.
Well, I don't think the Republicans are really
why are we talking about the
at all
Republicans?
capable.
These are the
at all
Democrats who are the
capable of even
majority.
understanding.
They
Because
got the House, they got the Senate,
and as a
and they
result
got the
of that,
president.
and as a result of
Raphael,
that,
can
we're not
we
dealing
agree?
with.
Can we come to anything on this?
I don't think that the other party is going to be capable of even
This has
coming in
bipartisan opposition.
the kind of changes that you're discussing. What we're talking about there, and the list of things that you're just talking about are much more progressive changes.
So if he put tort reform in there, you would say that
changes,
and these other things you think they would
the
impose.
Republican Party is simply not going
Answer
to
my
address.
question. Answer my question.
What's your question?
If you had put if they had put tort reform, like he's talking about, if they had put the ability to move across state lines, do you think? And I don't know. I'm just asking. Do you think they would have had the same level of opposition?
Are you asking me, I'd be in favor of it, or would be the same level of opposition?
I'm asking, do you think the Republicans would have opposed that with those things in the bill?
Okay, absolutely I do, because we're not talking about a rational discussion for the last 6 months.
Okay.
No, honestly.
Okay, I don't know. We didn't do it,
well,
so I don't know.
Like
I can't say.
You think that you are. You do
I'm
know or not?
throwing it out there as a comment. I asked you a question. I didn't say whether I knew or not. I asked you a question.
Okay. I'm answered it, though. I think that there was a vitriolic and very, very well organized opposition to this particular bill. Not even because it had to do with health insurance, but because it had to do with attempting to dismantle this administration before it even started.
Okay, Raphael. Well, then let me ask you. Let me ask you the question. Do you think what could Obama have done to get Republican support on this bill?
I think, addressing the tort reform, which he himself said he was in favor of.
And you think they would have done it? They would have supported?
I think it gets back to a couple before how we got to this place. I mean, if you go back to the first vote the Senate took, that was on Christmas Eve. They took the first Senate vote, they passed it with their full 60 votes. After that, I think that they knew that there were problems with that bill, and they were going to come back and fix it, and then go to conference. That's how usually the thing works. What happened was Massachusetts, and a Republican won that seat, Scott Brown, and all of a sudden the Democrats didn't have the filibuster-proof majority. And at that point, I think that's when Democrats were saying they're going to ram this thing through, whether the Congress is on board or not. And I think their whole way of thinking was wrong from the beginning. They didn't need the Republicans in the beginning, so they shut them out. At the end, they were just trying to bring them in.
Go on the other side here,
This
Raphael.
is risible,
because do you think that the Republicans would have done differently if they were in power? Come on now.
Again, the Republicans
they never would have touched it.
I agree.
They never would have touched
it. I agree.
They might not even call the Democrats. At least
they never would have even touched it.
President Bush joined with Senator Kennedy to pass the school the Nobody Left Behind Act. I was against that. President Bush did the Medicare prescription drugs, spent a bunch of money. He did that.
All right. Well,
Bushes have always reached out to Democrats.
All right, I got to stop
things
this. I really got to stop this conversation because I think that, truthfully, guys, I think you're giving too much credit to the Republicans. I think you're giving too much credit to the Democrats. But let's keep moving on. Let's talk about the abortion issue because this is the real hot topic. Okay, people are talking about this, and I am amazed.
First of all, the Cornhusker kickback was put in there because Senator Nelson wanted the Hyde Amendment in the Senate bill, and it wasn't in there. That's why I got the Cornhusker kickback. Again, Obama doing typical politics as usual. When I got to the House of Representatives, the Hyde Amendment is not in there.